Good afternoon. My short talk is the practical utility of social media platforms in pathology and laboratory medicine education. So, for my background, I'm a pathologist and a program director of the pathology residency training at the Philippine Heart Center, and I'm a assistant professor in pathology at the University of the City of Manila College of Medicine. Okay. Basically, the objective of this lecture is to highlight recent articles emphasizing the potential of social media in reinforcing pathology, education, and practices, to present some of the practical utilities of the social media platform in supplementing pathology training and education, and just to add on is to discuss some of the challenges and solution in the implementation of the digital pathology in a developing country. So social media basically has changed the way we communicate. Basically, social media started as a form of entertainment, at least for many people. Then eventually they become it changes the way we communicate, and now it is becoming more of a tool for education. It's gaining more relevance, especially in some academic institutions. So for my discussion would basically focus more on probably at least the more popular social media platform, the Twitter and the Facebook. So Twitter, we have a limited to about 140 characters, and the Facebook have no length limit. Other platforms of social media are the blogs. We have the LinkedIn, the Google, Instagram, Pinterest. So there are actually a lot of articles already published in many journals like the Archives of Pathology and Laboratory Medicine. Like this is by Dr. Allen. So social media pathologist force multiplier. So this article basically mentioned that pathologists in general are relatively smaller in number compared to other medical specialties, and so they believe that the pathologists can be more engaged in social media. It can create a more impact to the layman or to other specialists, because social media is fast, innovative, and it can reach a broader range of audience. However, in this article also by Dr. Allen, they mentioned that a lot of pathologists basically have social media accounts, maybe Twitter or Facebook, but they are not active or actively using this account. So it's trying to encourage pathologists to participate or to engage more in those accounts. And here, this is basically co-authored by Dr. Gardner, who is probably one of the pioneering pathologists from the United States, who is very active in social media. So there are even articles about the 10 simple rules for doctors on social media. And I think in the UK, this was even made into a policy so the Pathological Society of Great Britain and Ireland has a social media policy on what to post and or what to write in your account. The American Medical Association Journal of Ethics has even wrote this article, The Pathology Image Sharing on Social Media Recommendation for Protecting Privacy While Motivating Education. So with all of these articles, we already know that it's very important for, at least for, in many specialties, even more so for pathologists to be engaged in social media. So right now I'll talk more about how we, as a program director of this residency training and teaching in the medical school, how we do utilize the social media given the limited resources that we have. So in our center, the pathologists are working mostly part-time, so we have to create opportunities for more interaction with the trainees. So for this one, I created a Facebook page. This is the Pathology Residency Education Portal. So together with other pathologists, we upload here actual cases as well as links from other websites, and about 2 cases per week. And the membership here started basically around maybe 12 people, maybe 8 trainees and 4 pathologists, but this has grown into, we now have about about 700 members from all different parts of the world as far as India and Middle East. So this really created the impact. So we upload cases twice a week and let the trainee discuss the cases, and then we provide the answer at the end of the week. So this is an example. This is an example of the case. This is from a cellular mass, and we also upload links of some interesting articles for the trainees to have access. So we know that Facebook also have an associated platform. This is the messenger. So for this case, for example, we try. This is from a trainee sending me some of the images for a future slide conference, asking me what would be my opinions for this particular case. So together we learn through this platform. This is from a trainee. He's just started maybe around a few days. So really asking information how to trim a particular specimen. So through this messenger, we managed to have a mini tutorial using the social media. And sometimes we want, some of the clinicians would like to ask specific question in the report, and you do not really remember what you wrote from those reports. So you ask some of your trainee to, we ask some of our trainee to send a particular image of that particular case and probably the report, so we can clarify things with other clinicians. Over here, this is also since in our center we do not do immunohistochemistry every day, we do it every other day. So some clinician would like to ask the impressions over the weekend. So so we can ask the trainee to send pictures using their smartphone of the immunohistochemistry result, and so we can have some impression of the case. In terms of laboratory medicine, so if we have body fluids with concomitant cytopathology request, so here the trainee would send us images of those body fluid and ask for my opinions for this particular case. So using also the messenger, we can share videos as well. This is a video about how to trim specimen, which I found in the website. So here we are. So basically, our society in the Philippines has a particular website, but I think this is less access. So this is the Facebook page, initially started by some of the officers in this organization. So here we have around, there are about 550 pathologists in the Philippines. So relatively, we have a good participation rate of about 427. So over this website, we share articles here, and some of the newer concepts like a PDL1 or the PD1 or PDL1 are best explained with a video, because I think some of the more senior pathologists are not really aware of these concepts. So we try to use that, and we also try to share links of open source access for some of those articles. Some of the pathologists who are training overseas can also share postgraduate courses here, like the one in New York. And then we also tend to follow other pathologists, especially Dr. Gardner, who is very active in social media among the pathologists in the US. This platform can also be used. So here, this is from a pathologist from another part of the country who probably does not have any access on a referral system. So she tried to send me some of those photo and over the messenger, and at least ask for my opinions. This came from a medical student who where I am the advisor. So she was asking me a specific question about a forthcoming clinical pathology conference. The social media has also helped at least in the Philippines for us to gain access to some of the information, especially with the proliferation specialty group. In our center, we do have a lot of lung cases and heart cases, and so with social media, we managed to gain access and be a member of this pulmonary pathology group. We also gained access to a cardiovascular pathology group. This is basically based in India. And with my engagement in social pathology, I was invited also to be part of the trainee forum. This particular forum is based in this is in Singapore, the pathology training and RAC. So usually the members are trainees with some few pathologists who can moderate the discussion. This particular group, the DNB pathology, this is based in India. So I was also invited to be part of to moderate some of the discussion as well. And of course, we basically benefit here a lot for this surgical pathology discussion forum with about 23 members worldwide. And of course, over your engagement with social media, this particular Dr. Gardner became part of your. Most of his posting would appear in your feeds with making pathology learning much easier. So how about in medical school? The student nowadays are more on, we can call probably millennials. So most of them are more active on Twitter. So I also try to set up some account for that and then try to tweet and retweet some of the cases presented by some of these pathologists who are very active in social media as well. Okay. So with this, as we know, with the utility of social media, there are still comparison between what the social media can do and what a journal-based article can do. So as we can see here, the social media, the timing is immediate. In journal, it can be variable depending on how long would it be published. The review process can be crowdsourced, while there's a formal expert review. Patient details in social media are more limited, while in journal-based, it's more complete. The access there can be both publicly accessed, but the audience in social media, the audience are sorry are broad, or while in journal-based case report it's more restricted. But overall, the limitation of social media is that you cannot use that for clinical decision. It is not recommended. While in the journal-based, it can be cited in diagnostic pathology report. So I mean, I've read some articles that the acceptance of digital pathology, especially in developing countries, it's a little bit slow. But I think with more engagement of younger pathologists in social media, it can probably jumpstart or pave the way for a greater acceptance, greater adaptation of digital pathology. So I would mention a study. This is the only study available in the Philippines about, this was done about 5 years ago, the digital pathology implementation challenges in developing countries. This was done at the University of the Philippines in Manila, the National Telehealth Center, in collaboration with another author from the National Library of Medicine in Bethesda. So here they set up a we have images uploaded in the National Library of Medicine in Bethesda, and then the author set up a mirror website rather, from in the Philippines for the student to access. And then the medical student, the level 2 medical student, were given questionnaires on what they think about this. So the challenges they encounter is that by using the conventional or traditional microscope, the cost and maintenance of optical microscope is greater. The student have to share microscope in the teaching laboratory, where we're talking here of a public medical school, so there's no access after class hours. The glass slides breakage issues, and the faculty to student ratio is higher. Other challenges includes the cost of equipment is substantial, so like computers, whole slide scanner, it can be very expensive. Access to workstation is limited, especially after class hours. The internet access in academic network is often slow and expensive. And of course, the power and weather events. The biggest challenge in implementing digital pathology in a developing country is the internet bandwidth. So dial-up connection doesn't really work. The mirror server issues and web archive can be viewed on any browser with Flash player. So the author here, with all the challenges associated with conventional microscope, they find that the solution really is digital pathology. So problem with optical microscope can be alleviated by digital pathology. Sharing of microscope, the solution is digital pathology, glass breakage, and high faculty to student ratio. But what about the challenges associated with implementing digital pathology? So they created this probable solution. So the cost of scanner and computer can be very expensive. So the author think that the solution here is partnering with universities in the developed countries with limited in access to workstation. Probably the images can be web archived, which can become accessible in the local network. Internet on academic network can be slow and expensive. So the solution is also a web archive, which can be accessible in the local network. And frequent power outages and adverse weather events, probably a backup power sources. So in this study, the lesson learned basically is access to both server was satisfactory, but the local server was faster and preferred. So virtual slide is accessible through a local network, may enhance student learning in developing countries. So they also conclude that digital pathology may be a cost-saving option for developing countries, and partnership with academic institutions in developed countries is encouraged. So before I end my presentation, just to give you a call from the pathologists, a newsletter from the pathologists. So the pathologist's role in social media has never been more critical to the well-being, not only of pathology as a professional, but to the well-being of our patient. So that's basically my presentation. Thank you.